The straight ankle lock. This is a fairly common footlock submission in the world of combat sports. This submission is placing a large downward force at the ankle joint and can result in significant injury if you do not tap out. It is still considered safer than submissions like the heel hook, so it does not have the same taboo surrounding it. You can see my other videos on other footlocks like the heel hook or the toe hold. This video will be reviewing the pertinent anatomy of the straight footlock, how to apply the technique, and what injuries can occur, and why it's considered safer than other submissions like the heel hook. First, the review of the anatomy. The anatomy of the ankle joint. This was talked about in my other footlock videos, but we'll talk a little bit about it again. The ankle joint is an interesting joint. The bones of the lower leg meet up with the bones of the foot. Specifically, the tibia and fibula make a joint with the talus. It works like a hinge by going up and down. Dorsiflexion, plantar flexion. That means that twisting of the ankle is actually happening at other joints of the foot or at the knee. The tibia and fibula are connected by strong tibiofibular ligaments and have their own joint. The tibia is the big bone of the lower leg and supports about 85% of the weight that goes through the lower leg, while the fibula gets the other 15%. The connection of the tibia and fibula make up a bracket called the mortise that encases the talus. The ligaments that support the ankle joint are on the sides. The big deltoid ligament is on the inside, medial, and attaches the tibia to the talus and other bones of the foot. It's a very strong ligament that resists eversion of the foot. The medial malleolus is the part of the tibia that the deltoid ligament starts. The outside, lateral ankle is supported by 3 smaller ligaments, 2 that connect the fibula to the talus and 1 that connects the fibula to the calcaneus. These resist inversion of the foot. These lateral ligaments start at the part of the fibula called the lateral malleolus. For the straight footlocks, it is also important to point out how the Achilles tendon is traveling down the leg, crossing the ankle joint, and attaching to the big bone of the foot called the calcaneus. It is the connection of the calf muscles, the gastrocnemius and soleus, to the foot and acts as the strong plantar flexor of the ankle. There are also other muscles and tendons that plantar flex the foot and toes in the back of the leg. The technique of the straight footlock. This is a powerful technique that involves turning your forearm into a fulcrum under the opponent's ankle area, with the upper leg secured with your legs and the foot secured with your arms, usually tucked into the armpit. A big bending force is placed on the ankle, forcing the ankle into plantar flexion. It is a straight footlock, as there is no significant twisting as part of this submission, unlike heel hooks or toe holds. Part of the reason why heel hooks are so dangerous are that they often stress the knee ligaments. With ligaments in general, there are not a lot of nerves signaling pain, so the time between pain and damage is pretty small. Injury to knee ligaments like the anterior cruciate ligament, the ACL, often requires surgery and then a recovery of a year or so it's a pretty big setback. You can see my separate video on ACLs. Also, with twisting, fractures of even the big bones like the tibia can happen, as bones hate being twisted. Much of the initial pain from the footlock is from the pressure of the fulcrum on the back of the leg that crushes the Achilles and the other structures back there. There are certainly important structures being stressed by the straight footlock, but there's usually a lot of warning between the start of pain and the beginning of damage, which makes it a lot safer. Some people call the straight footlock an Achilles lock for these reasons. There are variations based on where your forearm is placed. The forces of the fulcrum can be moved closer to the ankle joint or closer to the calf. It will feel different. When the fulcrum is close to the heel or at the ankle joint, there's more stress on the ligaments and tendons in the front of the ankle and on top of the foot. If the fulcrum moves up the leg, then the crushing of tissues in the back will be the primary source of pain. So go ahead, experiment with a friend. Feel those differences. Be careful, of course. The ankle is built to plantar flex, but there is a limit to how far things can go. This is why there are also variations where the ankle is turned slightly into external rotation. This stresses the deltoid ligament sooner and makes it so it's not just an isolated plantar flexion force. With continued plantar flexion of the ankle, eventually things will start to fail. Usually ligaments will fail or other soft tissues hurt too much, like in the back, the calf, the Achilles, before the bones break. Even if there is a significant injury, these structures do not require the same recovery as, say, an ACL tear. Just like with other submissions, a long moment arm is important. This means that while creating a lever, your forearm is the fulcrum, having the forces applied further away from that fulcrum creates more force. To maximize the fulcrum of the straight footlock, try to get your lat, your latissimus dorsi, involved in helping get the toes down. Also, try to have control of your opponent's upper leg so they cannot raise their knee to alleviate the plantar flexion stress on the ankle. Yes, there are variations where the knee is not controlled, but there's less overall control and it's a little harder to hit this. So the injuries. The largest study on injuries from forced plantar flexion of the ankle showed that various injuries could occur. This includes an anterior ankle capsule avulsion, tearing, fractures of the distal fibula, or avulsion of the anterior talofibular ligament, fractures of the medial malleolus, or tear of the deltoid ligament. While this was done on cadavers and does not capture the exact situation of the straight footlock in live action, it does give some good insight. It should also be pointed out that depending on how that footlock is applied, where the fulcrum is, more force could go into the tibia as opposed to the ankle joint. This may cause the crushing of the Achilles tendon or the muscles in the back of the leg, but it could potentially cause a fracture higher up in the tibia or the fibula. But the amount of force would need to be a lot. Could happen. So there you have it. Another discussion of the ankle and the introduction to the straight footlock. Just means no twisting. Hopefully, you understand that while it is considered safer than other footlocks, it still can cause damage. I'm Dr. Lucius Pomerantz, black belt in Jiu-Jitsu and an orthopedic surgeon, combining these two worlds so you all can better understand what is happening with combat sports and your injuries. Please do not forget to like, share, subscribe, and get notifications so you can be alerted to my new videos.